Good morning, everybody, and thank you for joining us. This is Heather Thomas with the Joint Information Center for Snohomish County's response to COVID-19. Going to take just a moment to click buttons to make sure that all of the media joining us have permission to record. As always, you will have permission to record. We are also recording and we'll make that available on the Health District's website and our YouTube channel later today. So give me just a moment. Okay, I think I've given everybody permission to record, but if you run into any issues, please send a chat using or directly to Joint Information Center and I'll get that fixed for you. Before we begin, I do want to share that this will be the last weekly media briefing. We will be transitioning to a schedule with briefings every other week. So the next briefing after today will be on November 23rd. We encourage you to make sure you're signed up to receive press releases from the Snohomish County and Snohomish Health District's channels, as well as following all of our social media updates. As always, media questions can still be directed to the Joint Information Center, the county, or the Health District. We'll put those contact emails in the chat box in just a moment. Moving to today's briefing, we are joined today by Snohomish County Executive Dave Summers and Snohomish Health District Health Officer Dr. Chris Spitters. After each of our speakers have shared their updates, we will take questions using the chat feature. Please make sure to submit your questions to everyone so that all of our speakers can see. Thank you again for joining us. And with that, I will turn it over to Executive Summers.
Thank you, Heather. Good morning, everybody. I'm going to be really brief today, but I'm happy to answer your questions a little bit later. Hold on a second, there we go. I just really want to take a minute to thank Governor Inslee, British Columbia Premier John Horgan, and both the U.S. and Canadian governments for opening our northern border. Many businesses in Snohomish County serve Canadians who come south to shop, and many of our residents have family and friends in Canada who they have not been able to visit in 20 months. So opening at the border is great for business, great for our families on both sides of the border. So very much grateful for that. This actually closure represents the longest border closure in over 200 years between the two countries. So very significant event. So lifting of the restrictions is going to give people the ability to freely travel across the border, and that's really another sign of and another step in our recovery. So happy to see it, and just grateful that we're now in that part of recovery, that the border is open. So that's really all I have today. I'll be back for questions, but with that, I'll hand it over to our health officer, Dr. Chris Spitters.
Okay, thank you, Executive Summers, and good morning, everyone. Before we talk about vaccines for children, I'd like to share a quick update on this week's numbers. After 2 weeks of successive increases in case counts, we did see our case rate drop through the week ending Saturday, November 6th. There were 1,400 cases reported last week, down from 1,660 the prior week. That gives, combining those 2 weeks, gives a 2-week rate of 362 cases per 100,000 for that 2-week period running up through November 6th, and that's just down a notch from 383 calculated for the previous 2-week period. With respect to hospitals, although new hospitalizations generally have been declining over time, we do still have 61 hospitalized patients with COVID in Snohomish County hospitals, 29 of them on ventilators. Those numbers have been relatively stable in the low to mid 60s for several weeks now. On the vaccine front, the Washington State Department of Health announced yesterday that the 10 millionth dose of vaccine was administered in Washington State. I want to mention that even before the pediatric vaccines became available, we have been seeing an increase in vaccinations here in Snohomish County that roughly is in sync with the availability of the booster vaccines now. We've gone from about 10,000 doses a week, which is where we were running up through maybe the middle or end of October, and now that's jumped up to about 20,000 doses per week. We don't have, the state is not providing us yet with any data on, which are boosters, which are first and second doses, but the rapid increment in sync with the boosters makes me think that most of that increase is indeed the booster doses. That's certainly what we've seen at our health district sites, where about 75% of the doses being given are boosters, and a quarter are second doses, and there's just a sliver of first doses being administered. Moving on to vaccination for younger children, ages 5 to 11. As you're aware, the Food and Drug Administration and the Centers for Disease Control and Prevention 2 weeks ago, or last week and the week before, had a series of meetings where the vaccine was authorized and recommended for use in all children ages 5 to 11. It's been almost a week now since that. But again, as we shared last week, and you will recall from the larger vaccine rollout last winter and spring, the first few weeks of a vaccine rollout can be very frustrating and disappointing, especially for those who really want to get it done right away and can't get an appointment when they search for one, because the demand for appointments is much greater than the supply. Trying to find an appointment can feel kind of like trying to win the lottery. And we're certainly hearing these frustrations from people who are upset with what feels like zero availability. And although we're waiting on data to be released by the state health department with respect to the number of these pediatric doses being administered thus far, we do believe that probably hundreds to maybe thousands got started last week, and that pace will pick up and continue. Appointments are being added every day by vaccine providers, which are the healthcare system and clinics and pharmacies. They're reporting that these appointments are being taken right up almost as quickly as they become available. Again, not a surprise when there are 75,000 eligible kids in the county. And last week, we received into Snohomish County 16,000 doses. The forward-looking estimate for allocations is in the 6,000 to 10,000 doses per week range. So you can see that there's many more people, especially at the front end of this effort, who are interested in getting an appointment for their child than there are available appointments. And that's just the natural course of the rollout of any vaccine effort like this. Many providers, clinics, and pharmacies also were holding off on scheduling appointments and making them available for you all to get your children into until they were sure they had the vaccine on hand. And also various logistics were in place for launching the vaccination effort in each of their facilities. These vaccine providers include some clinics that are working in partnership with many of the school districts, which have started and will continue to be rolled out in the days and weeks ahead. The federal retail pharmacy program allocations also are coming in directly from either the federal government or the manufacturers, but this system is run by the federal government, and that's going directly to chain pharmacies that are providing the vaccine. Taking both the vaccine supply that rolls in through the state health department, as well as the direct shipping to pharmacies, we're roughly expecting a total of about 10,000 doses for the 5 to 11 age group to be coming to Snohomish County weekly. So again, I mentioned earlier, we've got about 75,000 children in this age range, and it's a 2-dose series. So that means that we have a goal of administering 150,000 doses as part of this effort. And at 10,000 doses per week, it's just simple math that it's going to take several months to complete the vaccination effort in this group. But as time passes, it will become progressively less challenging to get a spot as demand is addressed and the ratio of appointment seekers to available appointments decreases. We saw this same phenomenon earlier in the year when vaccines first became available for adults. There's an early crunch, then things even out, and likely in a few months, we'll again be trying to urge those who haven't started vaccination to do so. Again, just the natural history of a vaccine rollout like this. We understand that parents and caregivers are anxious, and we're trying to help share avenues for vaccine venues as they become available. On Friday, the health district published a list of the providers and pharmacy locations that were allocated vaccines. We're working on an update, and we'll have that on our social media channels and online at the health district's COVID vaccine page under how to get the shot. So if you go to Snow HD, click on COVID, then click on vaccine, and then click on how to get a shot, it'll take you to that page. So although it's understandably frustrating, I mean, our school kids, their parents, the school system have really been under duress for a couple of years now, and there's a lot of pent-up frustration. And so the arrival of this great news of vaccination for kids being available is simultaneously met, sadly, with some frustration just based upon the good news, which is the huge demand, and the difficulty, which is that we're only going to be able to do so much at a time. So although this is overall good news, you know, that we have so many parents who want to get their kids vaccinated, even though that's the case, we still have these limitations of the flow of vaccine. So the health district is working with the vaccine providers and also with school districts to try to address provide a full reasonable palette of options to provide access to the vaccine. But again, the consistent with national surveys that show that the preferred route by parents is to either get their child vaccinated through the regular healthcare provider or healthcare system or through a pharmacy. You know, that's where the bulk of the vaccine is going now, and that's where the bulk of appointments can be found. So we urge your patience and perseverance. Ultimately, all children will have the chance to get vaccinated within the next few months. And with that, I'll turn it back to you, Executive Summers.
Thank you, Doctor. Got a couple questions here. What % of county kids do you anticipate getting the vaccine, and what pushback, if any, are you getting against vaccinating 5 to 11-year-olds?
Well, as I said, our goal is all of them. But if you look at the vaccine coverage in older kids and adolescents, we're, you know, in the 50 to 60% range. Is what we're seeing there. We're certainly hoping for improved coverage in the older kids and a higher target and a higher plateau for the younger kids. So that's, you know, hoping for 100. If it goes exactly with the younger kids as it has with the older kids, we'd start to top out around 60%. Regarding concerns from parents and institutions about vaccination, not a whole lot. I mean, I think that there's some concern being expressed in the community that we're hearing about, you know, vaccine being mandated for kids in schools. That's not something that's in my hands, but the State Board of Health does have a objective, robust process that is actually a model for national efforts around making any vaccine required for kids, and I'm confident that they will follow that in a very judicious manner if and when the time comes for that. But right now, we just want to make the vaccine available for all the kids and get it rolling.
Yeah, and I have not gotten any negative pushback. I hear the opposite, actually, as Dr. Spitter said, parents that are anxious to get their kids vaccinated. I think it's a kind of a normal thing that families are used to, is vaccinations with kids. So that's where I'm hearing the pressure, and as Dr. Spear said, a little bit of frustration, but we'll get through it. It's really it. So I'm optimistic. Let's see. Is there a reason our case rate went down recently? Are school children still getting sick at a higher rate?
Yeah, I'm not quite sure why. We were all coming down, and then first we had a few weeks there of going back up, and then 1 week of coming down. It's very hard to, one, predict the course based on 1 or 2 weeks at a time, and I confess, I'm not sure why we're not declining as quickly as many of the other large counties in the state. Like you see all around the state, a greater proportion of cases are among school-age children. We're not really convinced that there's a lot of transmission occurring in schools. I think the schools are doing a good job of the prevention and containment efforts, but they're living in communities where there's a lot of transmission going, and then it comes into the school and gets detected and largely controlled. Sometimes there's transmission, but we're not having large outbreaks. But still, I'd say more so now than previously in the pandemic. School-age kids are a bigger proportion of cases, and that's the majority of what caused us to go up in previous weeks. And we'll see how things go over the next couple weeks and what the age breakdown of cases is as we progress here through the month of November.
Okay. Next question is, what is the health district seeing in terms of COVID-related mental health impacts on school-age children now that we're 2 months into the school year? How widespread, how serious are the impacts serious? And what is the county doing to help parents find mental health resources for children?
Well, I can speak to the broad issue. We're all aware in all age groups there are significant behavioral mental health impacts of everything, all the isolation, interruption of daily life, separation from family and friends, all that stuff, and then kids, all that social emotional development and learning that goes on. They've definitely suffered. And that's been reported, widely in the medical literature. These conditions are not a notifiable condition in Washington State, or really, I think, in any setting. And so, although we have an interest in kids' well-being holistically and their mental health, it's not an area that we have, a surveillance system for, or active programs addressing beyond some of our maternal child health work with young moms and their young children. So, but it's definitely an issue generically, and County Human Services also has some involvement there. I don't know if Executive Summers, you have any perspective from your end with that, but certainly we see it as an issue society-wide. It's a concern. I can't quantitate it for you, but here we are.
Well, I'm kind of in the same situation, and don't have any data on it. Again, a lot of these issues are handled through the school districts and individual schools. The county does have information about the general network that's out there, but I frankly am not familiar with what we're doing to get that information out to school districts that's different than normal. So come back to you on that. Okay, let's see. Given the supply of vaccine issues, does it sound like any kind of mandate for school children would be well into the new year, if at all? So any thoughts on mandates for school children?
Well, generally, any kind of mandate for school vaccination, as I mentioned earlier, would come from the State Board of Health. So you could address their leadership and ask them this question. But generally, there is a framework, as I said, for the State Board of Health to consider this, and it has to do with the nature of the disease, its impact on children and on society, the effectiveness and safety of the vaccine, and the feasibility of implementing a mandate. And, generally with these things, I think here at the local level right now, the first order of effort is to just get all the willing and available people who can and want to get vaccinated done, and then get more experience with implementing this and seeing larger numbers of kids vaccinated nationwide and seeing the safety. And then I suspect the Board of Health would consider these issues, but I don't anticipate. I'd be surprised to see a mandate in the short run, but that's not really in my hands.
Yeah, there's a question about when the updated information about Vaccination is expected to come online. We provided, I think, a link earlier, but
and I think it's by tomorrow afternoon we should have something posted that's up to date.
Great.
Meanwhile, I'll just say, you can, in addition to using those vaccine finders, you can also, and that list, you can just go to the chain pharmacy websites, once a day or so, and kind of go in and look for a spot, go to your healthcare system's vaccine appointment website, and just keep surfing those sites daily. And as time passes, the competition of the large number of people for the small number of spots will begin to even out over, the next few weeks.
Any consideration at this point to add a proof of vaccine or negative test in restaurants, bars, gyms, as is being done in King County?
Well, I don't think that our interests, have changed. That we want to encourage people to get vaccinated. We'd like higher vaccine coverage than we have. I think the Delta wave exposed the fact that even with even with 2/3 of the community of adults covered, that's still left enough of an opening for the virus to cause significant problems. So we aim for higher vaccine coverage. But, in our discussions locally here, I think we felt that it's not a clear, cost benefit, risk benefit. It's not clear that it's that the increase in vaccination coverage yielded by that would be, worth the various costs and risks associated with it. Now, it certainly provides those venues, patrons, with some reassurance around other people that are there are vaccinated. But when you look back up a step and look at what will the impact on vaccine coverage be, we're less convinced that it's, that the juice is worth the squeeze there, especially as our vaccine coverage gradually increases. The relative amount of gain that we can get from an intervention like that is limited.
Yeah, we're not at this point considering any such a mandate. I think many of those types of businesses and locations are implementing their own masking requirements and that are sort of consistent with their line of business. So I personally think that's adequate at this point. So, Doctor, I think for you, could you talk about incidence of children and myocardial issues?
Well, I believe what you're referring to is with the mRNA vaccines, including Pfizer's product, there has been a concern of very infrequent. It's like I have to look the numbers up again, but it's like 1 in a million kind of thing where the heart gets inflamed as a side effect of the vaccine. Usually these are mild to moderate cases that resolve spontaneously with, treatment, medication, follow-up. And they've occurred primarily in younger men, teens up through 30s or 40s. And that's a known but very rare side effect of the vaccine that we didn't pick up on until larger numbers of people were vaccinated. Important things to remember, first on the big picture, is that the frequency of myocarditis due to COVID in unvaccinated people is greater than the frequency of myocarditis due to the vaccine. And that, along with a host of other quantitated benefits and risks of the vaccine, have led the CDC and medical scientists around the country to continue to recommend use of the vaccine because it's overwhelmingly favorable risk benefit even with that. So there is some concern about, well, what about in kids? What I can tell you is that in the 3,000 children that were in the clinical trial that were the basis for the authorization and recommendation for use of this vaccine in kids 5 to 11, there were no cases of myocarditis attributable to the vaccine. There were a couple that had another condition that were the cause of the myocarditis during the post-vaccine period, but no cases due to the vaccine in those 3,000 kids. So there's no strong signal of a problem there. Certainly surveillance for that will continue as the vaccine is rolled out in young kids, and that information will be updated, as would the risk-benefit analysis. But at this time, there's no signal that myocarditis is going to be a problem in young kids.
Now that the Biden administration has its mandate out for employers with more than 100 employees, even though it's tied up in courts already, is the county working on a plan to require its employees to show proof of a vaccine or have regular tests per the requirement? And I would say, yes, not only a plan, but as you probably remember, some of our employees were covered under the state mandate for both vaccination and some sort of process, testing process, and exemption process. And so we do have experience with that. We've gone through it. Right now, we're waiting for the federal rules, proposed rules. They've been transmitted to the state. The state could adopt those directly or could do something that's tougher or more restrictive. And so we're waiting to see exactly what comes out of state labor and industries, and those will be the rules we implement. As was mentioned, though, this is tied up in court, so we'll just have to see in terms of timing. But we know what the process looks like. We know how to follow through with it. We will implement the state rules, whatever they turn out to be, and work both with our employees and others to make sure that they have clear rules in terms of vaccination requirements, testing if it's allowed as an option, and also the exemption process, which turns out is very time consuming. It has to be dealt with on an employee by employee basis. So we know it's very time consuming, and this federal mandate coming down through the state would cover a lot more of our employees. We'll cover all of them. So it'll be a big job, but we know the steps. We have the plan in place, just waiting for the final rule on that. Doctor, do you have anything more to say on that from your standpoint? You're muted.
Nothing to add. Executive Summers, you covered it.
Okay. Let's see. I think that looks like the last question. There's a link for some information about myocarditis. Yep. And anything else this morning?
All right, we will go ahead and wrap up for today. As a reminder, we will be moving to every other week for media briefings. So look for an update for November 23rd. Thanks and have a great day.
Thank you.
Thanks.